Hi everybody, I'm Susan Collini and welcome to our October Roundtable at Age of Innocence, the Renaissance Center Collini Laser Clinic, and the offices of Francis Collini, yes. I want to introduce everybody, but I'm going to start with Marley first because today is National Physician Assistant Day. And Marley is one of our physician assistants, so I know your mom's watching, so shout out, put all the bells and whistles on, Lisa, so that we can give her a good round of applause too. Yay, Marley! And to my right, your left, we're going to start out with Ronnie, our medical assistant, and we have Derek, who is our laser director. We already met Marley. And we have Sarah, our Age of Innocence manager and our social media director, and we have Karen, our nurse and our cosmetic nurse and anesthetician as well. So she follows us around OR, recovery room, downstairs, upstairs, everywhere. So, so welcome everybody. It's good to be back.
Good to be back.
I was missing last month, and you guys did an awesome job.
Thank you very much.
Really did a great job. We talked about lasers, so if anybody didn't see that segment, it was really great about lasers, and everybody did a really great job.
We did a little tour.
Did a little tour. Walking around is always important,
Yeah.
you know?
Seeing what we have going on.
Exactly. So today we're gonna start out with, as we all know, that October is Breast Cancer Awareness Month. And I have a little bit of pink in here. I don't usually wear solid pink, so I had to find something with pink. Marley's in her pink, and Karen's in her pink. Boys, do you have pink?
I don't own pink.
All right, you're exempt.
Surprisingly,
You're exempt.
I do not.
I was hoping for a pink computer here, but it was blue. But that's okay. That's good for baby boy blue. For those that you don't know, we're gonna have a new addition to the Collini family next month. So we're all excited that. Am I allowed to say the gender?
Yes.
Okay, little baby boy. So we're excited. Luca. Yes. So anyway, back to breast cancer awareness. So one of the things that we don't actually work with a lot of we do work with cancer patients because we're cutting everything out. So I don't want to say that we don't, but we don't have that daily in and out that patients like oncology or even regular practitioners that would see their patients due to medications and that type of thing. But it is very important. We are the stopping point where we're cutting out tissue that doesn't belong and it's cancer. So that's what plastic surgeons do. So we take out moles and lesions and that type of thing. But with regard to breast cancer, Dr. Collini does do breast reconstruction, all types. So, once your general surgeon has, performed a mastectomy, many women want to have reconstruction. So that's where we come in. We do those things, and that's a conversation between the general surgeon, the plastic surgeon, and the patient as to what they want to do. And there's all different types. I don't know whether I really should get into that because it's so much, but I'm gonna let our medical team, bring up a conversation that they have, and I'm probably gonna start with Marley on what your insight is into the breast reconstruction and how we can facilitate this avenue for our patients.
Like you said, there are so many avenues of breast reconstruction. So I think if you're somebody who just recently, had breast cancer and now are looking to have reconstruction, definitely come in for a consultation because then we can go over all the different ways that we can do reconstruction, from implants and then nipple areola reconstruction, nipple areola tattooing. There's so many different ways that we can, So
one of the things that you're mentioning that I know that there are major centers around the country that have the whole encompassing circle. I have friends of mine that have had breast cancer and have been down to Fox Chase or other centers where they do the whole gamut. And that's where we're kind of left out of that picture anymore because, Dr. Collini is an individual practitioner, so we don't have that direct relationship with the general surgeon. However, one of the things I think where we get a lot of our patients from is once they've had breast reconstruction somewhere, and maybe, unfortunately, they always seem to need some kind of, repair in the future, just, for aesthetics.
Well, that's
and-
where a plastic surgeon.
Right.
That's
Right,
where it comes
so
in.
that's where we come in. So we
Yeah.
see a lot of patients that have had, breast reconstruction in the past, and maybe an implant is a mechanical defect at this point, or there's a problem, then
Or
we
the
kind of
scar,
fix it. Or
yeah,
the scar they
people
want to
could-
repair.
Yeah, scar revision, or sometimes people have the reconstruction, but they don't have the nipple areola reconstruction. We'll just do that piece.
Right,
So.
right. Well, thanks, Marlon. Karen, I'm gonna go over to you now. Is there anything that you'd like to add as
Well,
far
I
as,
think,
you have a lot of familiarity with it, cause you've worked in that field before.
yes, I think with Breast Cancer Awareness Month, most women should begin very early and teach your teenagers how to do a self-breast exam. Best place to do it is in the shower with wet hands, and get to know the feel of your breast. I just had a conversation with a client of mine who felt a pea size something that she didn't think was there the month before, and went to her doctor. They were gonna watch it, and 3 months later, she has breast cancer. So I think consistency is something that's very, very important. I think with COVID, many of us put off our mammograms, our routine checkups, and then when we are now allowed to have elective procedures, we might have gotten a little lazy about it. So I really think it's important to put yourself up there as necessary to get it checked. And I think mammograms are not the most pleasant thing in the world, but to get that piece of paper that says you're okay is priceless.
It's always, it makes you feel much better.
Absolutely.
I know that you hit on a very good point through COVID, and we have not been doing elective procedures, and there have been a lot less just going to the doctor to
Checking
begin with
yourself,
and checking
yeah.
out. I mean, this is really important, and people, I know myself, I'm, to blame as well. I need to go to the doctor, and I haven't been, and I said, oh, it's been so many years now, and I'm thinking, oh my gosh, I need to jump on that bandwagon, but you forget how fast time just moves by, and all of a sudden it's a year, it's 2 years, it's 5 years.
I think
The last 2 years just is gone.
learning how to put their kids and their loved ones ahead
Yeah.
of themselves, and that's not
It can turn
the thing to
into a
do.
much bigger
The other
problem.
thing I wanted to mention, someone said to me not too long ago, their breasts are so huge that they can't really feel anything. And they were thinking about a breast reduction, and I wanted people to know that when we do a breast reduction, as Marley will attain to, we send your breast tissue away, so it's checked, and that's another maybe way of reinforcing the fact that we care about breast cancer and breast awareness, and we need you to feel the same way. And also, men can get breast cancer, which that kind of goes by the wayside, but that also should be something that is checked, especially if there's a condition called gynecomastia where men have larger breasts. They are more at risk
More
than they should.
One thing with, because in the laser center, I also do some scar revision, and I've seen people post mastectomy and post breast reduction. They have these fabulous surgeons when they go in, and their main focus is to make sure that you're healthy and to make sure that they take the cancer away and all of that. And that's the difference. Dr. Collini is going to go in and kind of make sure that you're aesthetically looking nice.
Right.
And they always say that, they feel good, but it just doesn't look good. They're happy, they're healthy, but then they start looking at the cosmetic aspects of it. And that's where we can do a lot of good for people.
I think that helps, and we really do support all of our friends and mothers, cousins, sisters, daughters that have had breast cancer. I'm very fortunate that there have been people close in my life, and thank God they're survivors, and we celebrate in their survival, and I know all of you do as well. And before I close, I just want to see if there's anything anybody else wants to shout out about before we move on and for the day. I think we're good.
Just check.
So I
Yeah,
want
no,
everybody
you're
to know that any of the products that we sell in Age of Innocence for the month of October, we're going to be giving you, we're going to take 10% of the proceeds, and all the proceeds will go to breast cancer for the month of October. So that's our little celebration of what we can do besides the things that we normally do, just in seeing patients and doing that type of thing. So just be aware that if you're thinking about your own good skincare and the things that you want to do, that you can do double duty, help yourself, but help those that are in need, so that we can find that cure hopefully in the future. Good. Okay. So, moving on. So the second part of our segment, I know that seems like it's a little paradox to do it back to back. It just doesn't seem like it goes together, but we need a little fluidity from this past month. So there was a video that we did that was not live. We did a video about 4 weeks ago after our last roundtable. So some of you may or may not have seen it. And the reason I wasn't here on the last roundtable was because I underwent a facelift. And a week after the facelift, we did a video so that people could see me and I could talk about it and get a very quick hands-on, so that you see right in the beginning, you know, what my experience and what I felt. And all of you asked, that were able to do the video with me, asked great questions, and hopefully now there are going to be some questions that some of you may or may not answer on the video live now. So jump in board if you have a question. I'm very free to answer it. And we did promise you that there will be some before and after pictures so that people can see the difference. For me, I mean, honestly, as we said in the video, I mean, I drink the Kool-Aid here at our center. So, you know, I participate in trying to stay youthful and doing services and procedures that have kept me in the forefront. But at the age of 63, it was getting to be time to decide that it was either now or never. So that was the catalyst. And it's been an interesting month for me because people know that I've done it, but nobody said anything to me. So I was like, okay, does it look bad? Does it look good? Do you want to ask me any questions? I don't know. So it's kind of been
I think one of the biggest things is that you just look like you slept for 50 years.
Yeah. Well, that
look,
is the key to a good aesthetic.
You don't look like a different person. You just look
right.
wonderfully rested.
Yes.
So I don't think anyone would generally. I think when people see a facelift, first of all, too, because you do keep up with yourself so well. Sometimes the change is unbelievable because people are really sagging and they're seeing all of that. And even
we did have that one patient that was about 4 or 5 months ago that I'm telling you, I've never seen such a dramatic change, because she had really waited. She was in her mid-70s and really waited a long time and had never done anything her whole life, and a sun worshiper, and major. So some of them really do.
So what you can do, you don't have to wait until your face falls into your soup, as we say. You can do something to just keep up and keep yourself youthful, because I think people look at a facelift like such a big deal, and it's such a taboo thing, and it's, I don't think it's the same way anymore. I think there's new ways. I think it's, me personally, being able to go through your experience, being so close to you, I never knew it was as easy as it was.
Well, I
now I'm
think
like, well, I hit a certain age, what do we do that?
Although some of you were in the OR, saying it's a pretty extensive.
It's an extensive. Yeah, I don't want to minimize it in any way, but I just feel like people think they're going to look like a monster and be in tremendous pain for months. And we filmed a video a week after you were doing it, and you looked phenomenal. So of course there's some bruising and there's some, you have to be careful because you're not healed. So you as a person need to be cautious, but you can go out in public, you don't look like, I know there's more surgeries you can do, like you said, if someone adds the eyes or they add anything else, it's a lot heavier of a procedure, but
I know for me there was no bruising. There was a slight bit of bruising on my jaw and on my neck, and but I was using our vitamin K cream, and which really dissipated a lot of that bruising within a week and a half. So
followed your instructions.
And I was very good about
Good
following our
It's the
instructions.
most important thing that patients can do is follow their instructions.
Right. Right, and do the things that we don't tell you to be crazy and whatever about what you should be doing. We tell you things that you really need to do in order to facilitate the best result. We want you to have the best result. We're your cheerleaders when you decide to undergo something like this.
And you've studied these things for
Right.
how many years have you been
A
here?
long time. This is 26, 27 years.
So you have 26 years of knowing what people
No,
should
actually
do.
27 years.
27
years we are this year. I can't believe it. It's a long time. Long time. So it was time. So I think if anybody, I don't want to duplicate our last video. So because that really goes into the whys I decided to do this. I just wanted people to know how my recovery's been, because after that week I was full blown back to work.
Yeah.
And that's not everybody, so I don't want to say that that's everyone, but for me it was, I was able to go back to work. I do paperwork, so I'm not doing physical activity per se. I'm not lifting patients any longer, that type of thing, so I didn't have to do that. But paperwork I was really able to keep up with, so.
Yeah, it's not
that was a
something
big-
you have to take a month off of work for. And I
Yeah.
think that's what people are mainly concerned about.
Right.
Hiding for that time frame.
And
It's not as long as they think.
I think it's very important, something Susan said in the beginning, when it's time and you decide to do something like that, it's usually, you go for it and you do it, and that's the way it is, and it's
So-
very satisfying to see.
One of the things, because I had a couple of people that said, you really didn't need it, you don't really look any differently. You said I looked well rested, that was good. But one of the things with the type of facelift that we do what's called the SMAS, the SMAS technique. And I have to read this because I never remember the long verbiage on what, because I always just say we do the SMAS. But the SMAS is, so listen to this, because
I see
everybody
Martin
here,
has it in her head.
it's not, okay. Superficial musculo-aponeurotic system.
Okay.
Okay, so that's what the SMAS stands for. So that's a thin layer of muscle and connective tissue that's deep in the subcutaneous layer, and that is what's being manipulated, tightened underneath. The muscles are being tightened. So it's a very different type. It's the facelift that you're going to get for the long term. So in other words, I didn't have a lot of skin that needed to be pulled up and tightened, which was a good thing. But I did have some wrinkling in the neck and some laxity in the neck. I did it primarily for the neck. But as far as my mid-face goes, this is where the SMAS is. It's in this area here. Those muscles are tightened so that for the future, the aging process is much slower. It keeps the tissue up where it needs to be. It keeps the musculature, because as you age, it starts to go downward. And if you look at any depictions of aging, we know, because we see these pictures all the time, when you're youthful and young, you look like you have this V where all of your tissue is up here. As you start to age, it goes in the they reverse, so that you're getting wider at the bottom and more narrow at the top. So, I had a couple people ask me about all right, stop that now, stop that. Poor Derek's always thinking he's getting old. No, Derek, you're still very youthful. But so this is what we try to do, is to shift everything back where it's supposed to be. So for me, this part was maybe more subtle for patients or for the normal public or my colleagues to see. But I know that I know I see a difference. You do. I mean, I know because you're my esthetician,
Yeah.
so you see that. But I really noticed in the neck. I can tell you that this necklace hangs a little bit lower now, so I have a little bit more
the neck
room.
is the biggest.
Yeah, I mean, I'm actually not a scarf on, and
The
my
neck's the
neck
biggest change.
is a big deal. And from a lot of women as we're aging, the neck is an issue, and no matter how much you keep up with things, the neck is really hard to address. We have a lot of great creams, a lot of great lasers that we can do in the meantime, which I've always been a participant. But contrary to popular belief, I don't have a facelift every couple of years. I mean, that's
We maintain
that's it.
radio
It's
frequencies and
it's a
lasers and
maintenance.
facials.
And as we said in the last video, I had a few people ask me if I did something to my lips, and originally I was scheduled for a lip lift, because as you do age, your lip starts buckling under. You just lose that youthful appearance of your lip. And I was originally scheduled for that, but as I was on the table, just having the lift actually lifted my lip naturally where it's supposed to be, so they elected not to do it, and I was very thrilled because I just feel like my mouth and my anatomy
Back
is
to
where it's
where you
supposed
want
to be, right? And so that's what I was really excited about personally, like around my mouth area and my neck. I think my face pretty much looks very similar. It's hard for me to see.
They're small, and this is what I was saying with people waiting, until the last minute to have something like that done. Small changes can bother you, and you can correct those small changes with something like that, and that will keep you good for a long time. So I feel like people wait to the very last moment until everything kind of falls, and you are able to correct before that.
Right.
And
So we don't say do a facelift at 20-something.
no, but
that's
just
crazy. We're talking about fillers, Botox. Actually, just good skincare is paramount.
what would you say is
peels-
a good age? Mid 40s into 50s?
For a facelift, we have seen women in their 40s do a facelift, and honestly, because I tell my story, I was one of the first guinea pigs for one of the original CO2 lasers at the age of 40, and I really had a very, very bad complication of that procedure, and I had a lot of scarring on my jawline. Anybody that knows me personally knows what I went through for a good 3 years of recovery, but really what we had to do in order to correct that scarring was I had to go in and basically have almost like a mini lift to release all the scarring. So at that time, I had what we would call in our practice a mini lift. We're going to talk about the different names and procedures in a minute. But I had that done, and honestly, I think that when I had that scarring from that laser so many years ago, it's been over 24 years now, it's over 20 something, it's really crazy. I think I had some residual scarring that really affected my upper lip, and I had some a deficit there, and I think when we did this, it's amazing,
Kinda
it
just
just
fixed it.
released it, and it's almost like I feel like if you look back at any of old videos that you can probably see it when I speak, but I feel really great here, and
Lighten
it
the
was
lip.
really lighten the lip is what we said. So that was a very good thing. But as far as getting back to what you need, so nowadays, so I would not have done that mini lift probably at that early age, had I not. So we didn't do anything with my neck. It was just about releasing this middle area of my face. I probably wouldn't have done it at that age. I mean, we have so many alternatives now that you don't have to be so aggressive as a facelift, because I don't want to say that this isn't an aggressive surgery, but it is something to be said about at some point you're chasing the corrective stuff that you can do with fillers, and you do so much, you're spending a lot of money. So at one point you kind of do this, you decide, okay, is it a financial thing? Some people just never want a facelift, and that's absolutely fine. We've been through this before.
We can maintain it.
You can still maintain looking so much better just in all the things that we have available now between lasers and fillers. But for that, really trying to keep your jawline sharp, keep your neck in the position. I mean, I know that, this is my only here, this is gonna be it for the duration. Does that mean I'm gonna stop doing things? No, I'm gonna, as I start to relax and age in the next 5 years or so, I'll still probably be doing fillers or whatever. And so you never know, it is what it is. You take a step at a time. You don't have that long-term plan, like I'm gonna have a facelift in 1999, I'm gonna have a facelift in 2005, you don't know. It really
It's how you
depends
look
on
and
what
feel.
you do. It's how you look and you feel, and you don't want to be too many in your life either, because it's harder and harder with each procedure. There's a lot of scar tissue involved, so you want to space it out enough to be able to get to maximize
So I
your
don't think
results.
people know also that you can do more than one. I know multiple
Yes.
people that have had more than one.
You know,
They've done it
probably-
in like their maybe late 40s, 50s, and now I've
I
seen
mean,
them
honestly,
in
I
their
think,
70s and they're having it done.
We've had a couple patients with like 3,
3.
and that's over like a 30-year span. So we're talking, and that's just because they're more aggressive. Do you need 3? No, I mean, like I've said to my mother, nobody needs a facelift. You know, it depends on what you want to do. But I can say that when you decide that you're going to be, you're going to do it earlier than later, your skin has a lot more elasticity, and your results are always better the younger you are, obviously, and your healing is going to be easier. So again, back to that question, what is the best age? So we have done patients in their 40s, and usually we don't do them for a full facelift. And let's get that terminology correct. What is a full facelift? So for us, and you really have to ask, if you're going to go to another surgeon, you really have to ask them what their lift is, because there's so many different names that are used, so many different types. You know, in the old, you know, about 10 years ago, there was a very famous lifestyle lift that's now out of business because there was a problem with that type of lift. And all they did was lift skin. So, you know, are you having a skin lift? Are you having musculature? Are you gonna, and every surgeon kind of has their own name for that. In our particular practice, we do a mini facelift and we do a full facelift. And a full facelift doesn't mean eyes and everything. There's nothing, that's all a la carte. So we're talking about everything from this plane down. So a mini facelift in our practice does not include the neck. A full facelift in our practice is this mid-face and the neck. So that's how we depict our lifts. I've gone online, and every doctor has coined a different term to make it easier. We can do this under local anesthesia, blah, blah, blah. If you're doing anything under local anesthesia, you're really not having a facelift. I don't care what they tell you.
That'd be
I don't care what they're telling you.
That'd be a rough facelift.
You know, if you're getting, you know, some local anesthetic and you're having a little bit of a skin lift, yeah, that's a different story. But make sure that you're paying appropriately too, so that you're not paying a price of a full, you know, what we call a lift, but that's why our pricing is different than maybe somebody else's, because we actually don't do those skin lifts. We don't think they work. You know, you still have to charge money, and then within a year or two, the skin just starts to retract, and that was the problem with the lifestyle lift. We saw quite a few patients that had those lifts, and like within a couple of years, their incisions were migrating down into their face, because if you don't take care of the underlying structures, that skin is just going to relax and just keep going down. So, and you have a wide scar and that type of thing. So, you know, you have to be savvy and really understand what type of lift you're getting. I mean, we only do those two types in our practice just because if you're going to go that, we think we can get that modest improvement with threads and fillers and the other injectables that we do. And we don't need to do anything else that's fancier to go to a lift. Once you get to that point where you want a lift, we're going to be dealing with the SMAS, we're going to be dealing with you know, the underlying structures and really tightening them so that you've got real longevity between the procedures. Like, I mean, for me, there was over 20 years between that first procedure and what I just went through. So, I mean, so you do get longevity out of when you decide to actually do a lift in our particular practice. But
and you said this, but just to reiterate, because I think a lot of people get confused when you say facelift, they think
you're
the
thinking
whole
eyes,
face,
forehead, everything. No,
right.
no.
The forehead would be a brow lift, and the eyes would be a blepharoplasty.
So, and they're all a la carte, unfortunately.
Yes.
You know, and
They're
so
big surgeries.
They're big surgeries.
Yeah, so we do all of them, but
We do,
Not
yes,
usually.
not all of
Usually
that,
at
but
one
with,
time.
And then the non-invasive, I mean, because this is something I'm considering, and something for someone my age at 34, you know, you do start to see little things happen, especially if you're crazy like myself. So that's where the thread lifts come in,
right.
and they're excellent for someone
Yeah,
my
the
age.
thread lifts are great. The new thread lifts are better. I know that, you know, some of us here have had thread lifts. You know, the old
They were
type,
different.
and they were
stayed.
different.
Yeah.
They were
And not that
different.
we're talking about that, but it's basically, it's just like a suture that goes into this area, and there's little barbs on it, and they're able to place the skin. If I'm
Right.
saying anything incorrect, let me know. And then you basically just build a band of collagen in that area that retains that skin in a tightened.
That
Black.
thread dissolves now. In the old days, those threads did not
Can
resolve.
cause some
They did
healing
not,
and
right.
some
and
difficulty.
it's just all under local anesthesia, so you don't need to go to sleep for that. That's
Super
just an
easy.
in-office procedure.
Right, just like
Yeah.
a filler.
It's
Right.
a super easy procedure,
Right.
not painful.
Mhm.
And and very.
I've watched a few.
In and out.
It was
I mean, you
in
do
and
get
out.
bruising,
For
you
sure.
get
Anything
some
that's
swelling and
entering.
edema, so you've still got a good week of
Sure.
recovery after even a thread lift or any of those other injectables. So
But it's a great even for someone older who's, not looking to go under the knife and maybe lasers aren't giving them the tightening they want. I know we're not discussing the PDO threads, but part of lifting is that, and they can really get a good
Another
result with
option,
that.
right.
I'm all about the threads.
that's because the age group. So Karen and
All
I
about the
think at one
threads.
time we wrote an article about what you do in your 20s, what you do in your 30s, what you do in your 40s, what you do in your 50s, 60s. So there are timelines of where.
Facials and chemical peels, 20.
Well, and that's
Lasers,
we're talking about
fillers,
lifts
and
to give you
Botox.
tighter skin, but doesn't give you better skin. So
No,
you
and
really
that's-
have to
have to
see
do
Yeah.
those of us
That
can
is
help
a
you with the
big
creams,
thing.
because he gives
yeah.
you tighter skin, we give you better skin.
So-
That's
so
the combination.
For those of you that didn't think I needed it, like my skin all look good, I mean, I can thank, between Derek and Karen, the estheticians, on doing lasers and, facials and resurfacing kind of things for years. I've done those for
People are
years.
under
And
the
I've been very
impression
religious about
that
that.
their skin is different and doesn't have. I had someone come in post facelift that was actually disappointed because their skin wasn't different, and
Right.
I was like, they're not doing anything to your skin. It's all they work hand in hand. So you always have to be doing something good with the surface. They're taking care of everything underneath. So you do have to improve tone and texture
And
and,
that's
all
where your
those
20s,
things.
your 30s, and your 40s.
That's where that maintenance.
That's what.
You should already be in a good spot by
Yeah,
then.
you're prepping your skin
Yeah.
for your face.
And you can't visit your esthetician too soon once you graduate
Nope.
at 22.
Yeah.
or wherever
Honestly,
you go.
whatever. And if you're an acneic person,
You're gonna see
I have a
some-
ton of teenagers. I have male, female, because sometimes that turns into a facelift patient in their later life because scars age like this and they fall. So we try to prevent that stuff in their early days of keeping, things looking better. But facelifts are also very helpful for scarring, and if people have ice pick and heavy acne scarring, when they dissect all that, it actually smooths out the scarring.
Right. That's exactly what happened to me with that,
Yeah.
laser that I
Because
had.
you buckled.
And you might say after that first laser that why I would ever have lasers again, but I will tell you
They're
that
totally different.
they're totally different, and we can all say we've seen a lot of patients, and a lot of us have gone through in this practice, experiencing the lasers and the microneedling and the radio frequency things that we have. And yeah, they're aggressive, but they're that middle of the road now. The machinery and the technology has changed so much,
great now.
and it really is good. And those two procedures do go hand in hand because, I mean, I can honestly tell you I've known Karen for a very long time. We won't say what because she and I just both celebrated our birthdays this past week. So, but I will tell you, she has naturally magnificent skin, naturally. And
Yes.
some people are really born with good skin. Honestly, I had beautiful skin before I went through that bad laser in my my early 40s, and I have done a lot of these laser treatments to counteract the problem that I had with that. So there's a lot of correction that lasers can do and really improve your skin, because I know people always comment on my skin. And it's been a long road, working on it and dealing with it, testing out things so that you don't have to test them out. We let you know exactly what we think.
You
Good,
have allowed
bad,
me
and
to
the
test
ugly.
a lot of things.
That's it. We've tested a lot of things. But we again, you did that thing on the lasers last month, and so we talk about this a lot. But they do go hand in hand.
And we
love
did
that.
do a CO2 prior to your
Yes, we did.
procedure.
We did about
Couple
2
weeks.
two or 3 weeks
It was
before
about
the
3
lift up.
weeks
I
before.
did do a laser prior to, so that's that was a little rough. And
That was rough.
I didn't mind it to be rough, but I mean it's just my skin was doing a lot of turnover and things going on. But I handled
It's worth it in
was
the
good.
end.
It is really worth it. You have to break eggs to make the cake, unfortunately, and you can't just expect that you're going to have one of these big procedures and walk in and look great coming
Tomorrow
out. You
you're
have to,
brand new. I wish.
yeah.
If I ever develop that,
That's
it'll
it.
do very well.
That's it. So I don't know if there are any other questions or things that any of you want to come up with. I don't want to be so long-winded and just do all the talking.
This is a question, and I know the difference, but I just want it reiterated kind of. There's this big impression, I'm really trying to get the men to really do more for themselves. Because women do like when men look good. They like shined up men. So
that's a good one. They like shined up men. Yes.
So is there a difference between a male facelift and a female facelift?
So I'll probably be the one to answer that. They really are the same procedure. However, probably doctor and those that do the procedure might address them slightly differently based on, I think from my own experience, and maybe you that are in the OR have more experience of actually seeing doctors do this, but I find that women are more elevated in this direction, and we try not to do that same heightened elevation because we don't want to feminize the face. I mean, we know of some of those male movie stars that have had facelifts that look a little strange, and I don't think you actually have to look strange in order to have a facelift.
Some doctors, they're unbelievable.
I think they're great. So I
think that's the fear.
I think that we just don't move this. We don't position as tightly. Number one. I mean, I know they still want lip. I mean, they still want tight. Everybody wants tight, but I think for most men, they're really going in for their neck more so than their mid face. So we're concentrating on really doing the neck well, and all the necks come out great and the same. So I think that they're the same. I think when you get to the mid face, you have to be a little cautious if you're a male patient, because you just don't want to look feminine coming out of a facelift procedure.
And something I'll say about a male facelift is they're definitely more drastic sometimes because men end up with the thicker neck, and when we fix that, it just redefines their jawline so much more, and it just
right.
Because for men, it's all about the sharp structures and the jawline.
Well, and we have a book that they could look through the pictures too, so they can get an idea of the before and after, and see that it's very natural.
Come on, guys.
That's it. I think that for men, their rejuvenation, the things that they talk about to me the most when I see them come in is usually their eyes. So they really are, they're coming in, and usually men wait till the last minute. They're not like women where they're coming in their 30s and 40s and doing something. I usually get them when they're already in their 60s and they're
spend a lot of time
and
in the sun, their construction or doing something outside.
That's it. And so, then there's some more drama in there. But men do it, but not at the same rate as women do. Men only take up about 11% of the cosmetic industry, and females take up the rest. So that tells you it changed. When we first started practicing, it was 90 and 10. Now it's 89 and 11. So the guys have come up 1%. So
working on it.
I account for 3%
That's okay. It's all good. But and sometimes what prompts people to come in is divorce.
Back on the market.
Back on the market. I mean, I hate to say that, but
I think there is a large uptick in men though, because I know that there's a lot of men that do the thread lifts because it's way less invasive. So I know that there's a big uptick in men doing more cosmetic procedures. So
Botox,
which is great.
Right.
I mean, you want to look good.
Yeah,
we can all look good.
ourselves.
That's it. It's always about trying to take care of yourself and trying to be relevant. Anybody else? Does anybody else have anything to add? Any questions at all jumping on board? Oh, Sarah's computer died, so if you have a question,
we'll answer them soon.
I plugged mine in just to be on the safe side. So I'll let Ronnie sign off. In the meantime, I want to let everybody know what we're doing next month. It's going to be very interesting. So if anybody has done any work on or reading about cellulite, because I know cellulite is a huge problem that all women deal with, there is a new injectable called Quo, and it's QWO. Quo. It's an injectable. It's technically not really invasive, but it does dissolve the fibrous bands that are in the connective tissue that create that little pocket or divot that we women all hate. So we are going to be talking about Quo next month because we do have it in our offices now. We're one of the first offices. It just came out, so we're really excited to be part of this. We're always trying to be new and give you the very best that there is out there. And we'll talk about other cellulite treatments that can occur or that we do have. But this is the latest, so stay tuned for how good we think it is because we will rate it. We have it in our offices now. So anybody that's interested in Quo, QWO, and it's an injectable and it's meant for treating cellulite.
And I would think, because we talked about this with other fat treatments and treatments where you want to be shown in the summertime, you should probably start soon if it was something like that.
Right.
So once we go through all of our things, it's probably something you want to jump on.
Right,
before summer.
because people wait till the last second.
Well, they
June
do
is
it in
here,
summer when they see
and then
themselves in
and
summer.
it really
and
does
then you
take a
have
healing
downtime.
process. So
Yeah.
really, if you really want to get prepared for next summer, it's
Winter.
starting right now and
Winter for
building
summer.
yourself up.
Hair removal, cool sculpting, lasers.
Right, so we're really ramping up. We're
Chemical
very
peels.
busy right now. This is a good time, but Quo is here, and we will be doing some discussion on Quo next roundtable.
Awesome.
The other thing that I want to mention is that in November we have our open house. So for those of you that know us, we've had an open house all these years, but last year it was virtual, and it's usually theme oriented so that it's fun. But as of now, our intention is to have a live open house again. We will require masks to come in just in case. It's like anything else. We're trying to make sure that your safety is paramount always. So it will be a masked. So maybe we haven't picked out our theme yet. So maybe we can tie in the masks with some kind of theme for our open house.
Give us some ideas.
So
if you're
throw some
excited.
ideas out there, because we haven't pinpointed that yet. But that's going to come up in November, and that date is November the 17th. So stay with us. We always have lots of fun, and you get a lot of free stuff and
A lot of specials.
a lot of specials, and you can buy things in our open house and learn about the things that we do and see it firsthand. And really talk to us one-on-one. And because I know sometimes in these forums of social media where other people are looking, people want to be more private. They want to message you privately. They don't want you to mention their name publicly. So we do understand that. Feel free to call us anytime because I'm around. Ronnie's around, Derek's around, Marley's around, Sarah's around, Karen's around. So we answer your questions,
Myself.
and we try to always give you the real deal with everything. So. Anyway, till we see you next month, and you'll see little updates, and hopefully we'll get the pictures out there so people can see my little timeline, because right now I'm at 5 weeks post-procedure. So
And
that you can see
somebody
it.
said you look stunning.
Yes.
Oh, thank you, whoever that was. It's probably my mother. No, she doesn't need to do so. She doesn't know my mother. It was might have been your mother.
Was it?
I love you,
Oh, it
Lisa.
was your mom.
It was your Lisa. Thank you. So that was fun. It was somebody's mother. It was somebody close to me. Thank you. It's just about trying to stay relevant. I mean, I know that unfortunately this is our business, and we drink the Kool-Aid here, but I know how most women feel. It's like, it's a hard thing as we start to age and you just don't feel like you're engaged, and this helps you do it. And everything that we do here in the center helps you to look and feel as good as you can. So
For sure.
until next time, everybody.
Bye,
Bye, everybody. See you next month.